Well, we're joined now by Dr. Tasleem Nimjee, an emergency room doctor in Toronto. And Dr. Nimjee, Public Health Canada's website is describing the risk of transmission in Canada as low. That might surprise some people. It does point out that it could change at any time. But I'm curious about, from your perspective, practically speaking, how should we respond to that assessment?
Yeah, so I think when we're talking about that assessment as low, that's again because almost all of the cases in Canada are cases that we can track there's defined a chain of transmission for those cases. So we can track the contacts, we can isolate them, we can test them so that we can try to still contain the outbreak. That said, we've heard a lot about the risk of community transmission and us moving into that reality. And that's why you've seen some of these really aggressive measures around social distancing in the last couple of days, really less than a week. And also measures like, decreasing visitation at seniors' homes, at long-term care facilities, at hospitals, limiting travel, all things that we can do to try to keep us in that low risk zone as opposed to moving out of that. Again, while we are in a low risk time, certainly doesn't mean that we can be cavalier, because it's these measures, really, these social distancing measures that are going to help us to flatten that curve, as we keep saying, to try to keep us at lower risk as possible, given what we're facing.